What if your lectures today could save 2 lives tomorrow? From fetal heart sounds to real hearts beating with hope. Every MCQ, every lecture, every sleepless night brings us closer to changing a life, or 2. This World Health Day, let's study not just to pass exams, but to deliver futures.
So hi everyone. So we are there live on the DAMS Transform session. Today is a very special day. We are celebrating the World Health Day, April 7th, and I'll ask Dr. Deepti to take the first shot.
So hi everyone, and what a wonderful way to start our day. And absolutely, it's also a day that World Health Day is being celebrated today all across the world. And it has a wonderful theme. So I was just going through the theme, and it's something that I truly believe in, and that was one of the reasons why I took up Obs and Gynae as well. So it is healthy beginnings and hopeful futures. And through this theme, we want to create awareness as about what about women's health, about practices that can improve women health, and in turn we can also improve the newborn health. We can reduce the newborn and maternal death, and that's how the beginning of life is, right? So I think the beauty of this is, or the branch that I pursue, is that through our motives, actions, skills, intention, empathy, we are not just saving one life, we are saving 2 lives, 2 very precious lives, right? And it always creates an impact which women remember throughout their life. I still remember when I was an intern, and I was so much into Obs and Gynae that I actually was doing my internship as if I was a resident in the department. I remember some of my patients who came up to me later, 1 year, 2 year later, and they would say, "Doctor, you did my dressing, you delivered my baby, and I'm yet again here for my second delivery." And those moments were truly very heartwarming. And I always love what I do, and I think it's a wonderful branch, and it is something which will always have a lasting impact, right? And I'm sure there are a lot of aspiring logicians today in our chat, and be rest assured, it is a branch which definitely needs a lot of effort, physical, mental, but it is one happy place in the hospital, right? People are usually happy to come, and they're even more happy when they leave the hospital with a child in their hand. It's a blessing, right?
Now, what we'll do today is I have thought of a very important part of the exam, which is a new thing that is happening for the last 4-5 years. Earlier, our exams, the competitive exams that you appear for, NEET PG, NORCET exam, these were primarily word or a textual question. And around 2013, they converted into computer-based exams. Gradually, they added image-based questions, and now they form a major chunk of your NEET PG and NEET paper. And there is a need to talk about how to approach the image-based question. That is the purpose for today. Now, let me ask you a question very fast. Whenever you look at an image-based question, there will be 4 parts to the question. The stem of the question, choices, image, okay, choices, image, stem of the question, and you look at those parts and in a sequence. Once you see the sequence, my question is, where will you start? Then I'll tell you the idea. Where will you start? Where will you put your eye first? Will you see the question first, choices first, or image first? Sometimes instead of image, they might put a video file also. That's very important. They can put a GIF file in the exam. Keep in mind, GIF file will have a moving body part. So where do you start? Where do you start? Anyone? So my answer is, So most people I see, one bacha is saying I start at the image, one bacha is saying I start at the choices. So what is the right thing? Keep typing, keep typing. Okay. Supriya is
I think
saying
I would start with the last line of the question.
options, image. Okay. So I am here to tell you the big difference between a MCQ and a clinical subject, or a clinical, when you're working clinically. When I'm working clinically as a radiologist, I start at the image, clinically, not at the MCQs. Because clinically, when I'm looking at a patient, I don't want to be biased by the clinical details. I want to see the image unbiased. That is the approach that the radiologist and pathologist they use usually. You see it unbiased, then you look at the clinical details clinically. But MCQ is a different world altogether. You have to limit your thinking process on the day of the exam so that you're not overthinking it. So in a MCQ exam, I start at the option. I see the four choices. I know what I have to differentiate. Then I look at the image only to differentiate. I look at the clinical stem only to differentiate. I'll give you an example. Suppose the four choices are pleural effusion, pneumothorax, pneumonia, and maybe, say pneumonia, pleural effusion, collapse, pneumothorax. So out of them, three are going to be opaque. Collapse is loss of air, it will be white. Pleural effusion will be white. Pneumonia will be white. Pneumothorax will be black. So once I see four choices, now I look at the image. If the image is showing a white lung, immediately pneumothorax is ruled out. Now I'm only thinking about three choices. You understand? Then I know collapse will have volume loss, pleural effusion will have volume gain, pneumonia will have volume maintained. I look at the trachea only. I don't look at the full image, only look at the trachea. If the trachea is pulled towards the disease, volume loss, central, then volume maintained, pushed, volume gain. Now, if the trachea is, central, then two choices are ruled out. I just need to confirm looking at the image, is this pneumonia? Then I look for air bronchogram. I go to the clinical stem. Is the patient having fever, cough, sputum production? And I connect the dots. So you start at the options, look at the image only to eliminate options, look at the clinical detail only to confirm. And Dr. Deepthi, because she was a step ahead, she immediately told you if the question is too long, start at the last line. If the question is
In
too long,
fact,
start at the
yes,
last line.
I am going to add something to this, right? And which is, Dr. Sumer is talking about radiology, which is actually a image intensive branch and an image intensive subject. But when we talk about Obs and Gynae, we have a lot of other things to ask other than the image. So, you have to know that sometimes in clinical subjects, the image is just a hint, right? It could be simply asking some theoretical concept or a theoretical part by giving you the image. So, in the clinical subjects, we would not be focusing on very tiny details in the image. It would be a gross finding that we want you to pick up. So, don't overread the image. Only look at the gross findings. For example, if we are talking about, chorionic villus sampling or amniocentesis or umbilical cord sampling, all I need to see is where the needle is. Is it in the fluid? Is it in the placenta or is it right in the cord? And that's about it. But what the question would be something related to theoretical content. Once you identify, we want you to integrate. So maybe the question would not be what is the image, the question would be what is the right time to do the procedure shown. Right? So, which is why, other than radiology, if we talk about clinical subjects and image based questions, you need to know that you will need to connect the dots, right? With
I think,
theory, with clinical application.
I think what Dr. Deepthi is trying to say is, and which is absolutely right, many questions sometimes in your initial paper NEET PG, image is actually irrelevant. Which
Yes.
she's not saying because she's being very polite. Sometimes they put an image, but it is not required in the question. You can actually solve the question without the image also. So
Yeah.
keep this in mind, especially in the core clinical subjects. So there are
Yes.
two kind of images. One is radiology, dermatology, pathology, which are core image-based subjects. In them,
Agreed.
you use the approach that I'm saying. But if it's a non-core subject, sometimes, for example, psychiatry, if they put an image in psychiatry, they will not, it's very difficult to put an image in psychiatry. But if they put an image in psychiatry, usually it should be solvable without the image only. Many times I have seen that many times the question, the person who will come give the exam will come back and say, sir, bina image ki ho gaya. चॉइस में ऐसा लिखा था. Dr. Deepti, are you there?
Yes, I'm there.
Yes.
Yes. So, agreed to what Dr. Samir is saying. So, focus on these aspects, and I'm sure that image-based questions usually turn out to be on the easier side. But what I have noticed as a trend in NEET PG, like we were talking about in ESET, what about NEET PG? And you're going to listen to me very carefully. There are two types of questions or image-based questions in NEET PG. Number one, something which is going to be very obvious, very simple. Okay, so there is nothing much in that image. It is probably used as a prop. The question would primarily be content based. In such MCQs, what I have seen is they will give you a longish history, right? So it is an image based question, but the image is very simple. The history would be long, right? Something that you have to pick up and then mark as the answer. But there are other image-based questions that I've seen in NEET PG where the image looks vague. It's very difficult to know what exactly was it. In these particular questions, what NEET PG is doing is they're giving a very short history, one and a half line. But in that one line, they will give you a keyword. For example, in the recent NEET PG, they showed you an image of didelphius. It was a gross intraoperative image, uterus didelphius. Nobody could know because we couldn't really assess what exactly the image is. But the hint, apart from yes, there were two horns, right? But they gave a very simple hint in the MCQ. They said this woman on speculum examination had two cervices, just one line with that vague image, and it was good enough to say that it is not biconjugate, it is didelphius, right? So this is what I'm trying to say. So it could be a different level of questions, but don't get perturbed. If the image seems difficult, then yes, you will be given some clinical hint, a keyword. So it again boils down to whether you know the keywords or not, whether you know your core concepts or not, and then you will be able to approach the image-based questions as well.
I think, Dr. Deepti, if we have added an image showing an ultrasound showing two uterus widely separated, that's the
Yes.
image of didelphys. But I can also, add maybe an HSG image. What was the image in the exam?
No, it was a gross image, Sumedh. So it was a gross image,
Okay.
intraoperative. Okay, I have given them in the test papers. I've taught that image in the class as well. But
Yeah.
as I said, there could be various ways of approaching the image-based questions. You have to learn the art of picking up the keywords, right?
Absolutely.
Okay.
And I think, the entire idea that, madam is saying is actually very relevant, that you have to look at image as one of the clues. It is a part of the building block. Many times it may not be the entire thing. You understand? Sometimes, like madam already said, I am adding it. Like, suppose I'm taking radiology as an example because radiology is a core image question. So if I give you a radiology question, I'll show you an image and say identify. Okay. But if I want to ask basic sciences, I will say, look at this image and what is the likely pathogenesis of this disease or what is the likely causative organism. For example, I may show you a delta sign on a NCCT and I will ask you which of the following drugs could be associated with. The answer would be oral contraceptives. I go to the basic sciences. While the second thing is, which is very important, I might show you an image and ask you management. So I might go to the clinical side. For example, I show you extradural hemorrhage and I ask you the management. Then the answer will be urgent surgical evacuation with a burr hole or a craniotomy. So it is how to use the image in the question is the art of the MCQ forming that the teachers are using. Easiest
Okay.
is identify the investigation, identify the structure, identify the disease, or how will you manage it, what is the most common side effect of the surgery, or we go towards the pathophysiology, which anatomical structure is, how is this structure developed embryologically, that is how, they might go. I'll give you an example. If I show you retrocaval ureter and ask you which part of the IVC is causing this, or I go into the embryology part of it, then it becomes a INICET kind of a style. In INICET paper, basic sciences are predominant. So even if they show a clinical image, they go back to the basic sciences.
Okay, I would like to just add. Can you let me know in the chat box who are the people who are scared of IBQs? Because then I have something special to tell you. So now, if you feel that this is not your forte and you do the IBQs wrong or you need more practice, please go to the test series section of DAMS-eMedicoz app. You will see Transform 10x mini test. Currently, I am doing a clinical vignette series in that, right? So we are doing clinical vignette mini test in that. But prior to the clinical vignette series, we did the IBQ series. So you will see IBQ mini test in the Transform 10x, right? From all 19 subjects. So it gives you a good practice, 20 MCQs per subject, various kind of questions based on images. So go ahead, do that. It'll give you a good confidence, and especially for upcoming exams where you could have so many types of questions in any set, ranging from image based to clinical vignettes, to match the following true and false and so on, right? So please go ahead and do the practice.
So what I'll do is I'll give the approach that we've discussed with an example. So you see in front of you an image of extradural hemorrhage. So if it is a radiology question, the question will be saying, identify the disease shown to you. Okay. But if I want to go in USMLE step 1 pattern or pathophysiology pattern or any set pattern, I will say, look at the disease shown to you. The artery or the blood vessel which is ruptured is a branch of which vessel? Now it becomes an anatomy question. The blood vessel rupture is middle meningeal artery, but it is a branch of, anyone in the chat box, it is a branch of, tell me, internal maxillary artery. That becomes your basic science question now. If I want to go to a surgery, I'll say patient with road traffic accident comes to you with this, and I show you the image, and I ask you, how will you manage the patient? So this is the approach to the integrated pattern of your image-based questions. So it is very important part of your exam. Many times the students come back and tell us the images were the game changer. That is why we devoted a special session only to talk about image-based questions.
Okay, and then we will just take up some of the queries in the chat box and we'll wind off the transform series for today. So Rega has asked this twice, ma'am, how to cut down main notes for revision before exam. So Rega, I think we've answered that query previously, but we'll do it again for you, bache. You don't have to worry about that at all. If you know that DAMS we, the teachers ourselves, have done this work for you through LRR, Live Rapid Revision. It is a part of various courses in DAMS, and here we ourselves have cut down, we have narrowed down the notes for you to keep it very, very high yielding. It will take you 50% of the time what you took to read your main notes of that subject. And then we went a level further because, close to the exam, you really want to do multiple revisions. So what we did is, then we did DBT, where you will again take 50% less time as compared to LRR. So it's like a pyramid that we have created. The depth and content was through main notes. Once you have done that, we have carved it out for you through LRR. So use that if you haven't used it so far, Rega. And then in the last month before the exam, you can actually just stick to DBT. Go back to main notes only and only selectively where you are doing your mistakes, right?
I think very important. And I am also one student in the app has asked, Madam, your predictor series questions today were very nice, but in the end you confused us in last two choices. I'm sure, Madam, you are going to do the predictor series on the YouTube today.
Yes. So from today onwards, we are starting special INI CT predictor series. The test is available free for everyone on eMedicoz app. It can be done on the home page under the daily quiz section. So you just have to attempt the test. It comes with discussions, but there is nothing like when the teacher is going to teach you. So at 7 p.m. live on DAMS Delhi YouTube channel, everyone is invited to be a part of the discussion series of INI Predictor test. And our Predictor series has always been, touch wood, has been very, very effective, right? And students were already asking me, ma'am. Yeah, कि मैम इस बार predictor series कब आएगा? Because in the last exam, when we did the predictor series, there were questions directly from the predictor series itself. So we are starting today. We will be conducting it for all subjects. We will keep you engaged. We will keep you focused throughout your preparation for any set. The three most important resources that you should do for upcoming NEET are Mission INI-CT. It's amazing. It is the most, optimum use of your time for revision. The second is what we are doing now, PYQ ka baap. Currently, live sessions are happening on NEET app, right? And the third would be the INI-CT Predictor series. Okay. Apart from this, I have told you before, and I will tell you again, in the Transform 10x mini test, if you scroll down, you will see special tests for NEET. There would be image-based tests. There would be special tests on surgical classifications, pediatric milestones, general surgeries, right? And so much more, orthopedic fractures. So everything is out there. Use the resources to the best of your ability. There is nothing better than testing yourself, identifying your mistakes, and working on your mistakes. Let's do it together, okay?
And I would like to tell Dr. Deepti that magnesium sulfate question that you put today in the Predictor series was tricky. It was tricky. So let's have the discussion. And
don't worry, I'll make it easy for all of you, okay? But all of you are scoring pretty well, Dr. Sameer. I just asked them their scores out of 20 in my Telegram, and majority of them are scoring above 15. So which is nice, which is very good. Okay, I did try and confuse you, but you guys are good nonetheless. Okay.
And also, I will be doing the PYQ Kebab radiology session tomorrow, and I'll again announce it tomorrow, so don't miss it. So on this note, we wish you all the best. Today's session, the main purpose was to talk about image-based questions, and side by side take your queries and help you stay motivated. And we wish you all the best. Keep rocking. More idea that we have is that the morning session transform, evening session some activity will be there either on a YouTube Predictor series or on the app PYQ Kebab. We will keep you engaged, and the engagement will be according to the exam that is upcoming. So that means and before we go, I also want to tell you that after INI set is done, we'll use the similar pattern for NEET PG also. So we'll be there every day. I wish you all the best. Keep rocking.
One last query, Gaurav. Yes, we will be doing a free INI-CT mock, and there are already 10 INI-CT mock tests available in the test series. We will also be doing a free INI-CT mock for everyone. We will announce the dates soon, but it will be around 20th of April. We want to do it closer to the exam so that you feel that you've revised, you're giving the test, and then you can sort of look up for your mistakes, right?
And if you've already registered for it, or you can still register, don't miss out on attending the INI-CT CBT that we are doing in dedicated computer centers. You can get the real exam feel. Most importantly, I have seen many people suffer because of the exam day anxiety, especially at your level. When we are kids, we are not that anxious. When we grow up slightly, we start getting more anxiety. स्कूल के समय पे ना PMT नीट यूजी दे रहे थे, डर ही नहीं था, पता ही नहीं था कि क्या हो सकता है जिंदगी में, क्या नहीं हो सकता. Now we have more awareness makes us more anxious. And that is why I want you to appear for NEET so that you desensitize your anxiety. Appear for NEET CBT, DAMS CBT happening on 19th of April. And please register for it before we close the registrations. We wish you all the best. Very good morning.
This session is going on live even on the NEET-MDS app, and there are students joined with us there. So Abhay, I know sometimes, in the morning you don't feel very pepped up and you feel that, oh God, you have to do everything all over again. Don't worry, Abhay, we are with all of you. We do understand your pulse. We do understand what you're going through. And that's why we know that it becomes easier when you are together in the tough times, right? And remember, the tough times don't last, tough people do, right? So all the best. Have a wonderful day ahead. God bless you all.